Good afternoon, everyone, and welcome to today's Care Connection webinar. My name is Susan Shipman, and I'm a social worker here at the Alzheimer Foundation of America. I'm extremely pleased today to welcome our guest speaker, Dr. Marc Agronin. Dr. Agronin will be speaking on the very important topic of preventing neurocognitive decline before and after diagnosis. Before we begin today's Care Connection, I'd like to go over a few housekeeping items. All the lines are muted, but we encourage questions, so please feel free to use the question box on your screen to type in any questions you may have. Dr. Agronin has a very comprehensive presentation today, so we will have a brief Q&A at the end of today's webinar if there is time. Any questions that you might have for AFA, please feel free to call our helpline, which I will include in the wrap-up email along with your certificate for attendance. Additionally, I will provide Dr. Agronin's information, but I will not be providing a copy of the presentation itself. However, the recording will be available on the AFA website, and all of you who are attending today will receive a link to that recording when it's available. All that said, let's get started. We are very fortunate to have Dr. Marc Agronin with us today as our guest speaker. Dr. Agronin has been part of Miami Jewish Health as a board-certified geriatric psychiatrist since 1999. He is currently serving as the Chief Medical Officer of the Frank C. and Lynn Scaduto MIND Institute and for behavioral health at Miami Jewish Health. He is a leading expert in Alzheimer's disease and geriatric mental health, and a nationally sought-after author and speaker. Dr. Agronin has written 10 books, including the critically acclaimed The End of Old Age, Living a Longer, More Purposeful Life, and How We Age, A Doctor's Journey into the Heart of Growing Old. He is also an affiliate associate professor of psychiatry and neurology at the University of Miami Miller School of Medicine. Dr. Agronin is a graduate of Harvard University, summa cum laude, and the Yale School of Medicine. He completed his residency training in adult psychiatry at Harvard University's McLean Hospital, and then a geriatric psychiatry fellowship at the Minneapolis VA Medical Center. Dr. Agronin is the 2008 recipient of the Clinician of the Year Award from the American Association for Geriatric Psychiatry and is a distinguished fellow of both the American Psychiatric Association and the AAGP. He is currently president of the American Association for Geriatric Psychiatry. He was the 2022 recipient of the Distinguished Ambassador in Aging Award by the Aging Life Care Association. He is also a national expert in Alzheimer's disease and other geriatric mental issues. In addition to his popular books, The End of Old Age and How We Age, he is the author of 8 other books and hundreds of articles, including Principles and Practice of Geriatric Psychiatry, 2nd edition, and a book for caregivers entitled The Dementia Caregiver, A Guide to Caring for Someone with Alzheimer's Disease and Other Neurocognitive Disorders. Dr. Agronin has been published in the New York Times and Scientific American Mind and writes blogs and articles on aging, health, and retirement issues for the Wall Street Journal. And now I'll turn the talk over to Dr. Agronin. Welcome, Dr. Agronin.
Susan, thank you so much for the introduction. And I really appreciate the opportunity to speak to everyone today. Without question, everyone has some encounter with changes in memory and other what we call neurocognitive changes, either in themselves or loved ones, sometimes which represent normal aging, sometimes which we perceive but really have no clear objective evidence. And sometimes they do actually represent what we call a neurocognitive disorder. So what I'd like to talk to you about today are, what are the main risk factors for neurocognitive changes and disorders in the first place, and emphasizing that even after individuals have neurocognitive changes or a diagnosis of a neurocognitive disorder such as Alzheimer's disease, that many, if not all of the strategies that we talk about that can help reduce risk play a role. So it will apply across the board. And for those of you who are worried about your own brain health, your own neurocognitive status, this talk will really get into that. And I'm going to hope to make sure we have time at the end for any particular questions. Also look in the Q&A box as we get to the end. So with that, let's jump in. So just to set the stage here, we know that the prevalence of what we now call neurocognitive disorders, as opposed to the term dementia, it's the same term, but I'm going to use this new term, neurocognitive disorders, just because it's a newly adapted term. It's a broader term. It doesn't have a lot of the negative connotations that dementia does, but we're talking about the same thing. We're talking about, as we'll define, anyone with a brain disease that's causing cognitive impairment. So if we look at the most common form of neurocognitive disorders, Alzheimer's disease, it represents roughly 70% of all cases of neurocognitive disorders. This is affecting nearly 6 million Americans, and it is expected to more than double within the next 25 years. If you look in the world today, roughly 50 million individuals have some form of a neurocognitive disorder, and this is projected to triple within the next 25 plus years. I'm in Florida, and this has almost 600,000 individuals with Alzheimer's disease. This has increased nearly 14% over the last 4 years. And I give Florida as an example, but I think you'd find in every state similar changes. And what's remarkable is that even where I work down in Miami, but even though Florida has the second highest prevalence of the United States, if you look at the number of clinicians who are trained and dedicated to treating this, it's not as high as you would imagine. And there's a lot of reasons for that. But what that means is that many individuals don't get the type of attention or comprehensive evaluation as soon as they need. Prevention is really ideal, and that's what we're going to focus on today. But, just in terms of Alzheimer's disease itself, deaths from it have increased significantly in the past 23 years. And it's the single most expensive disease, more so than heart disease and cancer. So it speaks to the gravity of this disease. It also speaks to the need for all of us to think about what we can do to either prevent it in the first place, or at least push off the expression of it until much later in life. So before we really get into what this disease is about and how to prevent it, let's take a little bit of a side journey into what happens to our brains as we age and what sets the stage for some of these changes. So if we look at why our brains age and what happens, I've broken down into basically 3 things focusing on brain cells called neurons. And I put it simply, neurons get dirty, they do less, and they die. So what do I mean by that? If you follow the life history of a brain cell or a neuron, what you'll see over time, just like any other physical entity, is it builds up a lot of junk inside of it. It's like you take a car or a house, any physical entity over time that builds up dirt and grime and it has wear and tear. The same things happen to our cells, and cells to some extent can repair themselves, rejuvenate. Different cells in the body are easier or more difficult to do that. Neurons in particular are very long-lasting cells. They don't regenerate in the way maybe skin cells do or other cells. So over time, it's more difficult for them to clear out a lot of the junk inside of them. And so as a result, they do less. They don't produce as many of the chemicals called neurotransmitters that help them communicate with other brain cells. They don't send signals as quickly. They don't have as much energy generated. And over time, neurons begin to die. And so shrinkage or atrophy of the brain is the rule, not the exception. Now, we can grow new brain cells, but again, that's not the predominant process. The other thing to keep in mind is that it's all about connections amongst cells. So even though you may have fewer cells, the more connections or synapses they form, the better. So this will speak to when we talk about risk mitigation. Anything you can do to keep your brain cells sprouting new connections is what it's all about. Now, if we follow normal individuals over time, let's say from age 30, when you have this plump, healthy brain, to those who are 80 who have a more shrunken, withered brain, pictured in here, And if you follow them, you measure what the study did. This is the Seattle Longitudinal Study in Aging. And they took groups of individuals in different age groups from age 30 to 80, and they put them through a number of different, basically IQ tests, reasoning, tests of reasoning, generating words, doing, tests of spatial orientation, mathematical problems, similar to what you find on, let's say, an SAT test or any IQ test. And what they found is that generally our intellectual skills, at least these specific ones, peak roughly between our 30s and our 60s, and then they begin to slow down and decline moderately in our 60s and 70s, more severe in our 80s. And I think anyone who's aged into their 70s or 80s can attest to some of the slowing and changes that they notice. In fact, forget about 70s, 80s, in our 40s and 50s, we notice some changes. Normal changes are common. And keep in mind that this data is only measuring certain skills. We'll talk about other skills that are not as commonly measured, but that show the opposite curve. So I want us to think not only in terms of decline and weakness and challenges, but in terms of strengths as well. That's very important because at the end, those really carry the day. What are normal cognitive changes with age? Well, we have what's called our crystallized intelligence. These are our skills, our knowledge, our experience. This basically remains stable or increases over time. We tend to build more vocabulary, or overall knowledge increases. And so this is the foundation for what we have in our skills. And we'll talk about a very important term called wisdom in a minute. If you look at what's called our fluid intelligence, this is our problem solving, reasoning, logic, pattern recognition. The process of these skills does begin to slow roughly at the age of 20 or 30. In general, processing speed in the brain is slower. We talked about what happens to brain cells. People have more of these tip of the tongue experiences or lapses where you can almost taste something you're trying to remember. I stuck in my mind. Sometimes takes longer to get that. It's also more difficult to kind of distract and suppress other things going on in the environment at the same time when we're trying to do one task. And so as a result, multitasking may be less efficient, a little bit slower. I don't want you to think that slower means worse or less. It really depends what skill you're looking at. But it's similar to many other functions of the body. Things do tend to change and slow down somewhat, but it doesn't mean that there aren't other strengths that emerge, and we'll talk a little bit about those. So keep in mind the following, that with time, your brain continues to develop. You're always gaining more experience. You're always learning. It builds up what we call our brain and cognitive reserves. And put together, this consists of the total brain connections, intelligence, skills, experiences that we accumulate over time. Brain reserve really refers to the stuff of the brain, the number of connections. Cognitive reserve is all those skills and abilities. And in some ways, it's like putting money in the bank over time. The bigger a reserve you have in your brain, meaning the more stuff or the more connections, it's protective as you get older, both for normal and abnormal or pathologic changes or injuries. And in addition, our brains have the ability to adapt and resculpt themselves in the face of change and even injury. This is called neuroplasticity. And there's two ways in which they can do it. On the one hand, they can recruit more brain circuits per problem. And they also can use both sides or both hemispheres of the brain more. And older brains are somewhat better at doing that. So I like to picture it this way. If you look at, right now we have slightly under 300 people listening. So picture all of you together in one room with an aisle down the middle. So that's all of you represent brain cells, two different hemispheres of the brain. So if you're a 30-year-old brain, I'd put a problem on the board and point to one or two of you and say, solve this problem. And if you know what to do, you can solve it quickly and efficiently, end of story. The older brain is a little different. In this case, I'm going to point to maybe 5 of you on one side, 8 of you on the other side. I'm going to say, get together and solve this problem. So on the other hand, the older brain maybe needs to recruit more from more areas of the brain. It might take a little bit longer, but there's strength in numbers. And this speaks again to the ability of older brains to bring in more circuits, more experience, more skills, more abilities, and you can imagine there's great strength to that. And picture this. If I ask you the question, when do you think you make better decisions or made better decisions in your life? When you were 18 years old or currently? Most people say, well, obviously, currently. And why is that? In part, it's because, again, you're using more brain circuits, both sides of your brains more. And so that adds an important element. So I always emphasize, don't just think of younger brains as better because there are strengths to older brains. And let me speak to that in very more great detail right now. So as our minds develop over time, and when I say mind, I'm thinking, obviously your mind is in your brain, but think about your mind as your skills, your abilities, the way you think about things. And there are three different approaches that happen over time that aging gives us. So the first thing is what's called post-formal thinking. And without getting into all the details of that, basically what scientific data shows us is older brains tend to be more pragmatic and practical. They're less reactive, rigid, and impulsive, despite some of the stereotypes people have. And so what this means is that your decision-making tends to be more measured. You take your time. You don't fly off the handle as much. You're not as rigid and reactive in your thinking. That's a benefit. There's also a change based on a theory called socio-emotional selectivity, largely pioneered by a Stanford psychologist by the name of Laura Carstensen. And what she has found, and lots of studies have supported this, is that older minds tend to perform more positive experiences and gravitate towards more meaningful goals and activities. We're actually more positive. We kind of do this calculation that, hey, the horizon of life is coming closer. If I'm going to make a choice or solve something, I want it to be practical and I want it to be meaningful. I don't have time to fool around, so to speak. And finally, a term called developmental intelligence. This was coined by Dr. Gene Cohn, who was a very well-known geriatric psychiatrist, actually a personal friend and mentor, a really unbelievable person. And what he said is that as we get older, our older brains or older minds are able to take all of our cognitive abilities, our emotional experiences and emotional intelligence, our judgment, our social skills, and put it together in a more balanced and integrated whole. So if you put all these changes together, this really is wisdom. And it speaks to the strengths that older brains get. I emphasize this before we get into this issue of risk, because I want you to keep in mind that it's not all about brains and minds declining and falling apart. It's also about building and gaining strengths and finding ways to put these into our daily life that makes a difference. And the more time we put into this, as I'm going to show you, it builds your reserve, it's protective, it improves your well-being. So I want to make that really clear, because the more wisdom you gain, and it does grow and develop with time, it serves a higher purpose. We share it with other people. It comes in different forms. People have different forms of wisdom. For some people, it's knowledge and skills, expertise. Some people, it's decision-making. Other, it's creativity. Lots of different ways in which wisdom can manifest. And we know that people who have higher ratings of wisdom feel better. They're more satisfied with life. They have better family relationships and marriages. They adjust better to aging. They have lower levels of depression. So wisdom is a key currency of aging, and it's something that we always can focus on. And I'll come back to that later in the talk. Now, people say, okay, that's well and good, but guess what? Memory fails us at times, and increasingly so. Why and what to do about that? And this question comes up. Anyone who comes to the Memory Disorder Center that I run here in Miami, I'm not first thinking about a disease or disorder. I want to know what's going on in their day-to-day life that might be affecting their cognition. So for instance, someone who has hearing loss is not going to hear and thus won't remember things. Hearing loss, as we'll talk about, is a big issue and a big risk factor for cognitive loss. Someone who's distracted, nervous, depressed is not going to be paying as much attention or concentrating as much. This is going to affect memory and other cognitive skills. Individuals who are just not processing experiences and putting it to memory because of fatigue, sleep deprivation, illness, medication effects also may have cognitive changes. And finally, we talked about these tip of the tongue experiences that become more common with age, illnesses, medication effects. All these things can also harm both short and long-term memory. So if we can identify some of these changes, these are easy to treat reverse right away. And so we always should be keeping in mind how we can optimize our brain function. And I will come back to that. I alluded to this before, but just to make sure we're on the same page, the term dementia, now we use this term major neurocognitive disorder or neurocognitive disorder. And basically it's a disease of the brain in which, with many different causes, in which one or more of the following cognitive domains. Complex attention, that's our ability to multitask, to do multiple things at once and switch amongst different things. Executive function, how we plan, organize, prioritize. Learning and memory. Perceptual motor skills, that's using and recognizing faces, maps, items, your day-to-day activities. Language, both communicating and understanding what's said to us. And finally, what we call social cognition, acting appropriately with others, which involves our ability to interpret social cues, to censor ourselves, to basically observe what we're doing and modify it within social spaces. So when you get impairment in one or more of these areas, not just memory, but memory is often fundamentally a part of this, but it affects other areas as well. This is what we call major neurocognitive disorder. And there are many types. The most common is Alzheimer's disease, roughly 60 to 70% of all cases. It's a disease of aging, which is why we see more of it today. In the past, we saw more vascular dementia. This is due to strokes either in the upper cortex or lower subcortical regions of the brain. Today those represent maybe 15 to 20% of all neurocognitive disorders. But in the past, they certainly represented a higher percentage in areas when people were not as attentive to high blood pressure and glucose and vascular risk factors. There's other forms, something called dementia Lewy bodies, related in part to Parkinson's disease dementia, something called frontal temporal dementia, which affects either the frontal lobe of the brain or the temporal lobe or both, which can result in either really significant behavioral changes and or language changes. And then finally, you can have a form of dementia or neurocognitive disorder due to medical conditions, trauma, toxins, illnesses, things like that. So, a lot of people get confused. What does it mean? Dementia, Alzheimer's disease, think about it like the term infection. If you have an infection, it means you could have many different types of infections, pneumonia, skin infection, things like that. Similar, if you have a dementia or a major neurocognitive disorder, meaning your brain function is declining, there are many different causes of it. So it's important to keep that in mind. When we talk about the main risk factors, we're going to focus on Alzheimer's disease, but keep in mind in general, these are risk factors for vascular dementia as well, for medically induced dementias, less so for Lewy body disease and Parkinson's disease, but nonetheless, these are risk factors for both developing Alzheimer's disease and perhaps other forms of neurocognitive disorders, but they're also risk factors for making it worse. And that's when the title I said before and after diagnosis, because if someone has a neurocognitive disorder, as you'll see, all these factors can make a big difference. So let's jump in. So if you look at guidelines from the National Institute of Health and Care Excellence in England, or you look at the U.S. National Institutes of Health guidelines, basically what we say today is that if you look at all the risk factors for Alzheimer's disease in particular, really 35 to 40% of them are potentially modifiable, meaning you can change them, you can reduce them. So if you look at early life, the main risk factors are genetics and education. Obviously, you can't change your genetics. And so that's something that you're born with, but sometimes knowing about it can help us, sometimes not. So we'll talk more in detail about each one of these. The main midlife risk factors are hearing loss, hypertension, and obesity. And the main late life, and usually when we say late life, we mean after the age of 65. Those main risk factors are smoking, depression, physical inactivity, social isolation, and diabetes. I'm going to go through each one of these just to give you a little more detail. So early life, genetics. And basically, when I say the risk, it means, some genetics can increase your risk by, double it to 4.5 times. And, if you can address this, how much you could reduce your risk by. But obviously, in this case, you either have it or you don't. Now, The main risk factor that I want to talk about today is one that is the most practical. There's some families that have early onset Alzheimer's disease, and most family members get it. And those are specific genetic mutations. Those represent the vast minority of all cases, certainly probably less than 5%. And usually those families know about it. And it's, you can test for some of those, but, by the time you're testing, most people, it's already being expressed in families. Late onset, after the age of 65, there are many different genetic risk factors have been identified, but none of them with the importance or with the significance of what's called apolipoprotein E, or ApoE. This is a gene located on chromosome 19. Remember that the way genetics work is you get one copy from each parent, and they come together on a chromosome. And depending on which ones you get from the parent, the expression is different. So, a dominant gene, let's say for, green eyes, if you have one of those from a parent, doesn't matter what the other gene, you're going to have green eyes. A recessive gene, one like for blue eyes, you need to have one from each parent to actually have blue eyes, which is why we see more green eyes than blue eyes, as an example. So in this case, you get a copy of ApoE from each parent, and there are 3 different variants. You could get ApoE2, E3, or E4. ApoE4 increases your risk and your age of onset by twofold. 2 copies increase the risk almost 5-fold. If you have ApoE2, that decreases your risk. ApoE3 is neutral. Most people have ApoE3, so they get an E3 from each parent. A lot of people I see have 1 or both copies of ApoE4. It doesn't mean you're going to get Alzheimer's disease, but you're at higher risk. It tends to have a little earlier onset and a worse course. Knowing whether you have this is really not going to do much for you. That's part of the problem. And so that's why we don't routinely test for it. I know some of these DNA tests like 23andMe, I think that you can include it if you want. I don't like people to find out and then fret about it. What I tell people is everyone should be on a risk reduction / brain healthy lifestyle, regardless of their genetic risk. So, that's typically how we approach it. What about education? So the risk really is higher if you have no secondary school education, which is very, 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 very few people. Theoretically, what we think is that lack of education limits your cognitive reserve. It's, the more you build up earlier in life, especially through higher education, earlier in life seems to make a difference. Once you get into, late 20s, middle age, it's not clear whether education is really going to be the same risk reduction in terms of Alzheimer's disease, but without question, it's going to build your cognitive reserve. And so it's important. And really interesting study, something called the Nun study. And this was started back in the mid-1980s. An order of nuns called the School Sisters of Notre Dame agreed to participate in this study. And what's interesting is that when the women joined this order, they were in their early 20s, and they had annual physicals. So there's an amazing amount of medical information on them across their entire lifetime. And they all agreed to donate their brains to the study afterwards, so they would know with a 100% certainty who had Alzheimer's disease and who didn't. And they found some really interesting things. First of all, they found that those women who had college education and really active intellectual activity, this is somewhat protective of developing Alzheimer's disease. Those who had stroke and head trauma had an increased risk of it. And something really interesting, one of the researchers looked at the essays that these women wrote when they first applied to the order. So these were essays they wrote around the age of 20 or early 20s. And she scored them based on the sophistication of their grammar, basically their language expression, and found that she could predict with almost 90% certainty which of the nuns went on to develop Alzheimer's disease. And this is on the basis of their essays. So I know people are, I imagine these college students scrambling and thinking, if they're going to generate these essays from the, artificial intelligence chatbot or something, it's going to hide, their risk factor here. But, the bottom line is that probably your cognitive reserve can be measured to some extent, even when you're in your 20s, and it speaks to its role being protective. And so I tell people, basically keeping your mind as busy and active as possible across your entire lifespan is really, really important. It doesn't mean you can't get Alzheimer's disease. I've met plenty of brilliant people who have gotten it. and people who maybe were not so intellectually active who didn't. This is just one risk factor of many, but it's an interesting one. What about midlife ones? So hearing loss. This has emerged to be actually a important risk factor. Increasing hearing loss increases your risk, almost doubles it. Most studies of hearing loss show that even mild hearing loss can increase your risk of dementia. And keep in mind, almost 32% of individuals 55 and above have some degree of hearing loss. Not clear why. It's not clear if using hearing aids, to what extent it reduces the risk, although it certainly does. The theory is that you're just understimulating your brain over time by having hearing loss. And so it speaks to, sensory loss you need to compensate. And that's why I always push people in a very practical way. I meet tons of people in their 80s and 90s who they're not as engaged with life because they just don't hear everything around them. And over time, they kind of tune out. And so that's why it's so important to assess and address hearing loss. High blood pressure, hypertension, also significantly associated with damage to the brain, vascular disease, damage to the brain, risk of stroke, which causes vascular dementia. Really interesting study looked at individuals and, had high blood pressure. One group, they really worked to get their systolic blood pressure on average below 140. A second group, they worked to get it below 120. What they found is that the group below 120 had 20% fewer diagnoses of mild cognitive impairment and 15 fewer cases of dementia, such as Alzheimer's disease. So it really showing that, over time, good controlled blood pressure is very, very important to reducing the risk of brain damage, which increases the risk of dementia. Obesity also increases the risk, mainly because it increases the risk of diabetes and other health problems that increase the risk of dementia. So to some extent, we're looking at secondarily what happens via obesity, but you can see it does increase your risk. By addressing obesity, it's not a big risk reduction, but it's certainly there. What about use of tobacco or smoking? So we know that smoking affects cardiovascular health. This in turn affects brain health. Now it's interesting because on the one hand, nicotine alone stimulates the brain. If you have rats run through a maze, you put them on nicotine, like a nicotine patch, they will perform better. We're actually doing a study here of people with mild cognitive impairment on the nicotine patch because it has stimulatory effects. So yes, you do get nicotine through smoking, but you also get all these other, toxic agents to your lungs, neurotoxins. It affects your blood pressure. I mean, it's wholly bad for you. There's no question. But it increases your risk both for vascular dementia and Alzheimer's. And vascular dementia itself is a risk factor for Alzheimer's disease as well. People who are having damage to blood vessels of their brain, who are having small strokes, are at a much higher risk for Alzheimer's disease. You can have both combined, and that's a much worse picture. Depression, especially in later life, does appear linked to an increased risk for Alzheimer's disease and other forms of dementia. The question is, why is that? And this is depression that goes untreated or not fully treated. Well, we know that when you're depressed, your stress hormones in your body from your adrenal gland are elevated. And we know these can affect the memory processing cells in your brain, in the hippocampus, which is a small bundle of cells in your brain that has everything to do with short-term memory. You can even see shrinkage of those important cells in your brain in people who have elevated levels of cortisol over time due to depression. Because depression, your body is kind of in a constant, fight versus flight state, and that increases stress hormones initially to be protective, but over time they actually cause damage. We also know that for some people, depression is actually an early expression of neurocognitive change, and having neurocognitive change in turn increases the risk for depression. So it's a really vicious cycle here. The bottom line is we need to identify and treat depression really vigorously, especially in later life. Physical exercise reduces the risk of cognitive decline. Exercise is without question one of the best things that you can do. In one study, individuals with higher levels of exercise had nearly half the risk of Alzheimer's disease. It also improves balance, mood, overall function, reduces mortality. So without question, being inactive is a big risk. Being more active, physically active, is significant and probably the most significant way to reduce your risk. Social isolation, loneliness is at epidemic proportions now. It's been much worse during with the COVID pandemic. And we know that people who are socially isolated have less cognitive activity, they're more depressed, have more health issues. Someone who becomes, they weren't before, but now is becoming more socially isolated, maybe an early stage of Alzheimer's disease because they're less able to plan their schedules, to be involved in things. We have to work together to identify, people around us to make sure that, they're not isolated, they're not lonely, that we jump in and get involved. There's been a lot written lately in the press about loneliness and the epidemic of loneliness, and it really takes a toll. And one of the tolls is increasing the risk of Alzheimer's disease. Diabetes also is a huge risk factor for certainly many health problems, for vascular disease of the brain, for Alzheimer's disease. One theory is that if you look at, what in diabetes, or especially type 2 diabetes, the problem is that the cells of your body are not as sensitive to insulin. Basically, insulin tells your blood cells, or tells your cells in your body to take up glucose, and glucose is the main fuel of the cells. So if you don't have insulin due to type 1 diabetes, or if your cells are less sensitive to insulin in type 2 diabetes, the cells don't take up as much glucose. Their metabolism, their energy is less, and this has all sorts of other problems with them. And so we know in the brain as well, the same thing with brain cells. The brain cells are less receptive to insulin. They're less energetic, and you don't want your brain cells to be less energetic at all. So in addition, diabetes with elevated blood glucose levels can damage small blood vessels. This is why people get kidney damage and damage to the retina. Also, small blood vessels to your brain get damaged as well. Other risk factors across the board: traumatic brain injury, especially early in life with loss of consciousness, increases the risk of Alzheimer's disease. Little bumps people get, minor concussion, not as much. It's really more significant brain injury earlier in life. People with repetitive head injuries, such as in sports, this is associated with chronic traumatic encephalopathy, also with Alzheimer's disease. Really interesting research has suggested that oral hygiene plays a role. Studies have shown that poor oral hygiene increases bad bacteria in your mouth. And those bad bacteria are associated with increased risk of amyloid protein, which is one of the toxic proteins that cause Alzheimer's disease, in a really stunning way. Think about how close the mouth is to the brain, and there are people who, can get oral infections that can also seed the brain. So, brushing your teeth, seeing your dentist, these are actually ways to reduce your risk of Alzheimer's disease. Sleep disorders, especially obstructive sleep apnea, your brain is deprived of oxygen for a good part of the night, or lower levels of oxygen, and this is a risk factor for brain damage. Elevated cholesterol and homocysteine levels are associated with heart disease, also brain disease. And we also know women after menopause, when estrogen ceases production, this increases the risk of Alzheimer's disease. And so we know that, this is why many women are at much higher risk after menopause compared to men. So I've given you all the bad news to some extent, all the things, the risks and what can go wrong. So what can you do to make things better? And let's talk about that for 10, 15 minutes. We want to improve aging. You want to live better and longer, improve memory, reduce the risk of neurocognitive disease, live better even if you have neurocognitive changes. So first of all, there's no magic formula. So many people are taking these over-the-counter brain potions and formulas. I will tell you, none of which do anything. And I will stand on that, because at the end of the day, I say, someone who makes a claim, show me your data. Do you have studies that have been comparing your product versus placebo in large groups of people with rigorous scientific protocols you've collected data on many people, you've published it in peer-reviewed journals, meaning that the techniques, the methods are scrutinized by other colleagues, and it's out there for anyone to read. If you haven't done that, you don't have scientific data. A lot of people say, well, there's this one study of these 12 people or these 13 people, or, that says this and such works. That's not rigorous science. And you can find studies claiming lots of different things. At the end of the day, you want large, rigorous scientific research and consensus that something works. So the only people benefiting from all these products are those people who are making and selling them. And it's really no difference than, the old Wild West when, Doc Smith would come riding in on town and want to sell the old snake oil to people. It's really not that different. It's the same very sophisticated marketing. But, if you really look into research these things, no data that it really makes a difference. I wish people want some magic pill, but unfortunately it doesn't exist. And people will forego the several medications in the market that are FDA approved that have data because they, for some reason they want something different or magical. Caffeine, nicotine are, these old stimulants can make a difference. And if you're a rat running through a maze, helps, your morning coffee, some people's cigarette, maybe get your brain going. That's not a treatment for neurocognitive change. And just because you want to believe it doesn't make it true. I found this a number of years ago, according to a major scientific source, chocolate stops Alzheimer's disease. Well, if only that were true. If I could prescribe chocolate to my patients, I would be very happy, but unfortunately, that's not the case. And, you can't really count on that. And, jellyfish extracts and all that don't have all the scientific data that would really allow anyone to say with certainty that they make a difference. So, I would say if you're using a, supermarket tabloid or word of mouth or, some YouTube video to, base your scientifically sourced brain tonic on, probably not going to get the result that you want. You might think you're getting it, but, I would never prescribe this to someone. That would not be an ethical way to do medicine. And, people ask all the time, what about cannabis and CBD oil? No evidence yet, a lot of wishful thinking, a lot of big business fantasies. Not to mention there are potential negative health and cognitive effects, impaired judgment and memory from cannabis. The NPR just did a really nice piece on cannabis use the other day. In fact, I've been interviewed for it. And, the bottom line is that ER visits for seniors because of cannabis have skyrocketed. There's simply no data to make a difference. CBD oil itself is probably pretty benign, but it doesn't help. There's no evidence. The THC in cannabis itself, no evidence that certainly not does improve cognition. And plus, if people are smoking it, they're getting all the other toxins from smoking. So, a lot of hype about this, but the data is not there. So I'm going to give you an overview of a healthy lifestyle and break it down a little bit. There's 4 components, and you don't have to spend a lot of money to address these. Number 1, exercise. Moderate exercise, most days a week, 30 to 60 minutes, improves blood flow to the brain. Your brain releases more neuro growth factors that makes your cells more apt to make connections. Exercise, number 1 way to reduce your risk. Number 2, the only diet that really has more rigorous data showing not only maybe helping cognition, but reducing your risk is called the MIND diet. It's basically a combination of a Mediterranean diet and a anti-hypertension diet, rich in fruits and vegetables, fish, olive oil, healthy oils, less high sugar and processed food. If you have your 1 glass of wine or spirit a day, that's okay. I'm not saying to stop. And remember, 1 normal size glass. But I would encourage you, read on the MIND diet. Eating should be enjoyable. It should be fun. It should be socializing with other people. The whole process of preparing foods. And, it doesn't have to be perfect. If someone's selling you on some crazy restrictive diet, you just, you have to ask, is there really data showing that makes a difference? And do you want to put yourself under, some really restrictive diet for so many years, and then guess what? Find out it doesn't even make a difference. That would be, I tell people, don't deprive yourself. Keeping your brain stimulated, games, puzzles, volunteer work, adult education, learning a new skill or language. I'll talk a little bit more about this in a few minutes, but just doing things that you enjoy. And, soothe and protect your brain, get enough sleep, adequate hydration. Activities like meditation, yoga, or prayer can really help center your brain. See your doctor regularly to address all the risk factors that we talked about today. So we talked about exercise, and it decreases the loss of brain cells. It can maintain or enhance cognition, lowers the risk of dementia. You have better blood flow to your brain, more neurogrowth factors. Do something you enjoy so you keep on doing it. There's no magic to it. Walking is one of the best ways to do this. And I think they talk about, wanting to get over a threshold of 190 minutes a week, which is really doable. You don't have to become a triathlete or go and injure yourself doing crazy things to get this benefit. So it's really for anyone. Try to challenge your brain when you stimulate it. Do different things. Crossword puzzles are great, but if that's all you do every day, try to mix it up a little bit. Learn a new language. You don't have to become fluent at it, but just to challenge your brain. Get involved in the arts. One study showed that people involved in volunteer work or other activities more than 6 times per month lowered the rate of dementia by almost 40%. Brain games are great if you enjoy them, but there's no magic to one or another. And again, do what you enjoy. 2 studies looked at brain training. So the IMPACT study had people do a brain fitness program using a computer 5 days a week. They compared to a group that just watched these educational DVDs. You can see this is a little bit of a dated study. These people were cognitively intact. The treatment group did better across all cognitive domains. They felt better. So doing something active with brain fitness can be good. And this is where some of these computer programs, Brain HQ, Happy Neuron, Lumosity, things like that, can be helpful. Another group just did cognitive training. Another study, they did cognitive training in memory, reasoning, and processing speed. And they were compared to a group not doing it. And, the treatment group, surprise, surprise, did better. Booster training helped. I think it's a way of saying that keeping your brain busy and active with games, puzzles, reading, lectures, just like what you're doing right now, is really good. And I think that's a no-brainer, so to speak, but certainly makes a difference. Don't be afraid to use memory tools if you need to. Date books, calendars, sticky pads. Keep things in the same place. We call it a memory place. If you're always losing your keys, walk in, have a bowl to put them in every day, have a routine. These tools can make a difference and can kind of take some of the stress off your brain to focus on other things that you want to. And you can train your memory too. And there's lots of ways to do that. We talked about the MIND diet. It's called the Mediterranean DASH. Intervention for neurodegenerative delay diet. And if you just Google MIND diet, tons of stuff will come out. But you can see in the picture, it's a colorful diet. You focus on 10 brain healthy food groups. Try to minimize or avoid brain unhealthy groups. Red meats, butter, stick margarine, cheeses, pastries, all the things all of us love to eat. But it doesn't say to eliminate them, but it just means to, don't make that the staple. My friend and colleague, Dr. Gary Small, has a great book called The Memory Prescription, and I think he does a revision of it. But, he basically had people on a moderate caloric intake diet, emphasize antioxidants, omega-3 fatty acids as part of a Mediterranean diet, low glycemic index carbohydrates, and I think I have some slides on these. Really deeply colored green and blue fruits and vegetables, have really strong free radical, really strong what's called oxygen radical absorbency capacity, meaning they mop up in the body and brain these oxygen species that can damage cells and damage DNA. Glycemic index, things like fruits, better than, French fries and breads in terms of, you get sugar from all of them, but it depends on how quickly the sugar is released in your body. And so by shifting to more lower glycemic index, reduces the risk of high glucose, of, issues with diabetes. So he incorporated these into the diet. And what he found with a small group of individuals is that if you look at the top graph, this is from his book, The Alzheimer's Prevention Program, he believed that just exercise alone can delay the onset of dementia symptoms by almost 2 years, compared to a sedentary lifestyle. If you add in his prevention program, all the dietary things and activities, he thinks you can push symptoms off by 4 years. So look, if you're in your 70s or 80s, that's a big deal. That makes that you incorporate that with all this other risk reduction. I think what we're saying is that, you might not be able to actually prevent more neurocognitive change, but you can slow it down or push off, the impact of it in many ways by incorporating these things in your lifestyle. And these are not crazy changes to make. Two other things I want to mention before we wrap up. So first of all, I really have, in my research on the strengths of aging, what I found is that people who have an increased sense of purpose, the data is so strong, showing that they have fewer heart attacks and strokes, lower rates of mortality, they live longer, and that reduces your risk of Alzheimer's disease and other forms of dementia. Having a sense of purpose. What do you do? What do you wake up to do? What's important to you? Do you have something involved in your life, relationships, volunteer work, whatever it is that gives you a sense of giving to others more than just yourself? Building something, building a legacy. Having a sense of purpose has emerged as an incredibly important and, for many people, life-enhancing and life-saving aspect. And in addition, it's often based on having a positive view towards aging. And this Yale psychologist named Becca Levy has done a lot of really groundbreaking research on the fact that people have a more positive view of aging. Now, positive doesn't mean they're happy-go-lucky, smiling and whistling all day. What it means is that they believe that they can do what they need to do. They have self-confidence and belief in themselves, that this positive view is associated with better health, almost a 40% reduction in the risk for Alzheimer's disease, up to 7 years longer of life compared to more negative views, poor health, poor function, shorter lives. It's really stunning. And so being able to get involved in things that can help cultivate a more positive view of aging, having a sense of purpose, can have a really enormous impact, even for individuals who already have neurocognitive disease. When they come in here, I say, we're not just saying, take this pill, I'll see you in 6 months and you're declining and suffering. I say, how are you going to live an active, positive lifestyle now, despite these changes? And I encourage people to do everything possible and really to focus on wellness in addition to everything else. And let me give you a really good example of this fasting study called the counterclockwise study, conducted by a Harvard psychologist by the name of Ellen Langer. So in 1981, she did this study. She recruited 70 men in their 70s, and they agreed to give her about 2 weeks. She put them in a van. They drove up to an old monastery building in New Hampshire for a week. And before they left, she measured all these elements of their bodies, how fast they can walk, their blood pressure, their visual acuity, their memory, their hearing, things that we all associate with aging and getting worse as we get older. So she measured them when they arrived and walked into this monastery. And again, it's 1981, but they walked in, it looked like it was 1959 when they were younger men. All the decor, the magazines, the music, everything was made to 1959. And they basically were told, you were going to live like it's 1959 for the next week. And they had a ball for that week. At the end of the week, she measured, again, all of those factors, their blood pressure and their visual acuity and their hearing and their gait and all that. And what do you think she found? Their bodies seem younger in terms of their walking, their posture, their vision, their hearing. Literally, their cognitive scores improved, and their bodies and brain seem to impersonate their minds. So it's not so much about telling people you need to be younger or think younger. It's about saying, if you see yourself as more capable, If you project yourself as more able and more confident, guess what? It becomes somewhat of a self-fulfilling prophecy. You're not going to cure Alzheimer's disease by telling someone to be more positive. That's not the point. The point is that we tend to go to our expectations. And if you see yourself as falling apart and really doing poorly, guess what? Often that becomes the case. Fascinating study. So in summary, and then we'll take a few questions. We can modify our risk of developing neurocognitive disorders as well as mitigate their symptoms and course. The key is to identify and modify these risk factors as soon as possible. And really what we're talking about is, as I outlined, a brain healthy lifestyle. There are no magical formulas or harsh and expensive regimens. You know, if you're reading a book and the book says, stop eating this, stop eating that, don't do this, don't do that, forget it. There's no clear evidence. Or if a book says, make these 30 lifestyle changes all at the same time and you'll be better, no one can do that. And, you know, I think a perfect example was, you know, some of these diets that you literally have to change your entire lifestyle to accommodate these diets. And maybe, you know, 0.5% of the population that has, you know, time and money and help can do that. Most people just can't do that. It's not realistic. And so I tell people, you know, look at a brain healthy lifestyle, take good care of yourself, keep moving, keep active, do what you enjoy that enhances your brain so you keep on doing it. If you hate doing something, you're not going to keep up with it much. And why live miserably when, you know, this is time to enjoy life, to enhance your wellness. So that's your take-home messages. I have a number of books if you're interested. How We Age talks about a lot of patients I work with in situations seemed almost hopeless, but hope returned in many cases. And it's about aging, the aging process. The End of Old Age is a sequel, and it really talks about many themes today about what strengths emerge with aging and how to really identify those, like wisdom and resilience and creativity. And the Dementia Caregiver is just a to Z guide if you're caring for someone with Alzheimer's disease or another neurocognitive disorder on you know, what to do. So, and these are easily found on Amazon. I'm going to look, I know there are questions here. Why don't I try to run through some of these questions, and then we'll, you know, if you want, just type them in and let's address some of these. So,
okay, Dr. Agronin, I do have a couple from email that I'm going to
okay.
I'm going to address to you. One of them is you mentioned that women have been found to have an increased risk of neurocognitive disorders, especially Alzheimer's disease, after menopause.
Yes.
Is there anything that has been found to prevent or help that? Do we know why it happens? Would it be best for women to continue with HRT or estrogen therapy?
This has been a really complex and controversial area. You know, some initial studies contradicted themselves. You know, on the one hand, suggesting that hormone replacement therapy could reduce your risk of Alzheimer's disease. Another one suggesting it increases your risk of dementia. I think a lot depends on what are someone's risk factors to begin with for hormone replacement therapy. Obviously, there's a risk of certain malignancies from it. For certain people, hormone replacement therapy can increase the risk of stroke, and that in turn can increase the risk of dementia. So I don't think there's a clear consensus. You know, in general, we do believe that the loss of estrogen sets up the risk. And so obviously replacing estrogen would seem to reduce that risk. But the problem is the replacement of estrogen and other hormones has other issues and side effects. So I just tell people with respect to this, you know, you have to talk to your gynecologist or your other physician and really, you know, review them. Is this something appropriate to begin with? You know, it used to be very commonly used. It's not so commonly used now. So, you know, that's the bottom line, is it's really not clear, and it's not one size fits all. You know, everyone has different risk factors, different personal histories, things like that.
Okay. And the other question I have here is that I heard a talk recently that said that doing crossword puzzles isn't necessarily as supportive for cognitive reserve, because as learning new skills, new information, because we're using knowledge, i.e. vocabulary, that we already have. In order to build cognitive reserve, we're meant to learn something new. Could you comment on that?
Well, I I do think crossword puzzles can play a role because it's not just about tapping into what you know. It may be researching things you don't know, doing it with people, so you're socializing and discussing things. You have to think and in many different ways. So I think crossword puzzles can be great, but I would do more than just that. And what I would do is, do a crossword puzzle. And what if you learn from it? Maybe you learn about a new author, someone's history, look up their history, read a book from the author, a word from a different language. The more active you are with it, the better. And, take breaks, get up, walk around, exercise. So I think it'd be great for people, but it's like if you go to the gym and all you do is, work your biceps every time, you're going to have great biceps, but the rest of your body may be a little flabby. So, just mix it up. That's key.
Okay.
Okay.
There is a question that came in the question box, which is very interesting. Do married people have less social isolation because the two are always together? Or is social isolation more about friends and outside group activity?
Sure. In general, people who are married or living with a partner do better across the board. Mortality rates are lower for many different reasons. One is probably less social isolation. At the same point, you can be very isolated being married. It depends on the state of your relationship. Are you involved with other people? So yes, it's important, but we always encourage people get involved with friends, with organizations, religious groups, just that you're with both your partner or your spouse and other people as well, or optimize the relationship you have at home. I think that's really important. And I can run through some of these other questions quickly as well.
Oh, sure.
So someone said their mom had a diagnosis of Alzheimer's disease, but sounds like maybe a nurse practitioner said the diagnosis was incorrect, gave her mom false hope. So if a neuropsychologist and a geriatric doctor has suggested a diagnosis, the question is on, what's the basis? So I look less at, the outcome. Let's look at the data and let's have it explained. What did the neuropsychologist find? What did the geriatric doctor find in the test? What did the nurse practitioner find? And, this is where you have to educate yourself and get into the details of it. And if you're really stuck, I tell people go to a memory disorder center where this is all they do. But you have to educate yourself about this. So, what do we look at? And I'll make this very quick, a comprehensive evaluation like we do here. I look at the history, what's changing, what's the person, what's not working as well. What does neuropsychological testing show? Are there areas that they struggled with? Have they done a brain scan? Are there other tests that need to be done? Nowadays there are certain tests that we can detect Alzheimer's using blood, using spinal fluid, using a certain type of brain scans. So, when you put all that together, you get the information. I don't like to, I want to be frank with people about the diagnosis, to the extent that I can determine it, but I also don't want so much doom and gloom. I want people to understand that these are changes you're going through and we're going to deal with them. And, some people get so stuck in the diagnosis that they get hopeless and forget about that. And we can't let that happen. Word number games help with brain health. Absolutely. And, how much do they help? I'll be frank, the studies looking at people doing brain games and whatnot doesn't show a huge major change, but it helps. And that's why I tell people do something you enjoy. So at the end of the day, even if you're not increasing your memory by a certain amount, you're having fun, you're more relaxed, you're doing it with people, there's benefit to that. That's part of wellness. Someone said the rationale behind why diabetes or high blood glucose levels is rated as a risk factor in late life and not midlife. Well, it's true. It is a problem in midlife and late life too. In terms of the maximum impact of it, I drew these risk factors from one of the major studies, something in the Lancet, a journal called the Lancet. So they're looking at its main impact, but without question, in midlife, it can set the stage for problems, but when you really see the problems more later in life, many years of exposure to high blood pressure and high glucose levels. Both type 1 or type 2, yes, there's a risk with both of them. It really depends on how well controlled it is. If you have really good control of blood glucose levels and other risk factors, you can mitigate the risk. Someone asked about inflammation, a risk factor under diabetes. This include inflammation of arthritis. No, I was really focusing just on diabetes, not arthritis. So I wouldn't look at that as a risk factor. Someone wrote, my husband has mild cognitive impairment. The neurologist had him taking large doses of omega-3. He's been doing it for years. Would it be safe for him to stop? It doesn't protect his heart. I think the data on omega-3 is not as strong as people would like it to be. Unclear whether it really does anything for the brain. Less clear it does for the heart. Recent studies that have not been as clear. Probably not a big problem or risk for it, but I would address that with the patient's physician or cardiologist and, really press them on it. And if you do want to, I tell people, if you want to risk, let's say you have a question, does omega-3 help brain health or whatnot? Don't just Google it, because Google, you're going to find all sorts of things. And probably the number one article is going to come up from people who sell omega-3. And of course, they're going to say it's great. Go to something called PubMed, P-U-B-M-E-D. PubMed is, you get into the scientific literature. And it's a little more challenging because it comes to bring us all these scientific studies, but it's interesting to do and look at, and it may give you an answer. You can certainly go to, websites like from Mayo Clinic and others that might talk about that. The only issue is that they won't get into as much details. But, if you're a little more sophisticated, you can go to PubMed and look at what the studies show and read it for yourself. I like the Harvard letters. By Harvard Medical School puts out lots of different little booklets on walking and nutrition and all that. I think those are the best guides because they're always going to be based in science. If they recommend it, or if it's not recommended, probably because the science and data is not there. And so, go to their website. I think it's Harvard Publishing and peruse which magazine, which, ones they have. Dr. Small's AD prevention program would help other dementias as well. He focused more on Alzheimer's, but yes, I think it could have an impact on vascular dementia. Unclear on, Lewy body disease and frontotemporal dementia, probably not as much impact on that. But Gary Small has a lot of really good books out there, and he's a good friend and colleague, and he's very practical in what he writes, and it's all based on the latest science. Someone asked about music therapy. Music therapy is not going to decrease the prevalence, the risk of getting a neurocognitive disorder, but music therapy is a wonderful part of a wellness regimen for anyone, and it's good for your brain. So I would say, people, especially with neurocognitive disorders, as they advance and they lose cognitive abilities, sensory abilities are always there, and music therapy can tap into old memories and really make a difference. And if you want to really see this, go to YouTube and type in Alive Inside. And this is a project done where they brought iPods to nursing home residents many of whom were pretty withdrawn. And it's like they came alive with music. It really was extraordinary to see. So music is very, very powerful. I'm actually reading Oliver Sacks' books, Musicophilia, right now, which is all about the science of music and how it affects the brain. It's really fascinating. Someone wrote, I struggle with insomnia. What about exercise, counteracting negative effects or poor sleep? So if you have insomnia and it's really persistent, you need a sleep study to see, what's going on with it. Are there any specific sleep disorders? What's causing it? And sleep specialist can really talk about what are the best ways to improve insomnia. Exercise during the day is one good way for wellness, and maybe can help, but it really depends on what's causing the insomnia. And I'm always really, really cautious with sleeping pills. There's exercise is not going to hurt unless you're doing exercise right before bed and getting yourself all worked up. But without question, a sleep study will help at least tell you what's going on. Someone said, thank you. I didn't talk about any medications because that's a whole separate topic with Alzheimer's disease. There are 4 cognitive enhancing medications in the market approved by the FDA. That's a whole other talk. If you have specific questions, I'm happy to answer those. When someone enters a new, more social living environment from being in isolation, can this increased stimulation reduce the progression of disease? So this is an interesting question. I don't think anyone has a study that's going to show that, but I believe firmly that we can alter the course for anyone, making them feel better, improving wellness, improving their overall health when they're getting more mental, social stimulation. It's really, really important. And if that makes them feel better, reduces stress hormones, they're more attentive to their body, they're happier, endorphins are higher. Absolutely, I think that can affect the progression of the disease. Can I show you a hard study proving that? No. But just in my own experience doing this for, 25, 30 years, there's no question that can make a difference for people. Anyway, someone just said, thank you. That's great. Thank you. We talked about sleeping, many common sleep medications, even most over-the-counter sleeping pills, aside from melatonin, have the antihistamine diphenhydramine in them. For some people, that can impair memory to some extent and impair cognition. So that's why you have to be very careful. Even when someone says, oh, it's safe over the counter, either it's something that's herbal that doesn't have any proof it makes a difference, aside from placebo, or it has diphenhydramine, which can actually have negative effects for people. So you have to be really careful. If someone is really struggling with sleep, I say go to sleep specialist, get a sleep study to begin with, because if you have obstructive sleep apnea, you're not oxygenating your brain enough. You need to have that addressed. And the doctor can help guide you on the best medication if it's needed. And there's a lot of newer ones in the market that will be safe. The typical ones like benzodiazepines, your Ativan, your Xanax or whatnot, those can increase the risk of falling, increase confusion. Alcohol is always bad for sleep. So, without question, you want to make sure you get this attended to. People may be under stress, they may be depressed. And if they don't address that, the sleep is going to be an issue. Someone asked about a glass of red wine. So the bottom line is that in the MIND diet, it's allowed a glass of wine if you do that. I tell people, if you don't start. And people with memory, issues, you have to be careful because, they have their one glass of red wine and guess what? An hour later they forgot, and they have their one glass of red wine. And then a half an hour later, they forgot they had their glass. So they have another one. That's not good. I don't think anyone has shown that red versus white versus dry, anything is better than another. I would just say the following. The reason why there's a lot of hype over red wine in particular is because it's high in something called resveratrol, and resveratrol is touted to be, have effects on health, on brain health and all that. No evidence that makes a difference. Someone looked at a cell culture, they put resveratrol and the cells seemed a little, healthier or whatnot. The person who actually developed this doesn't even take it himself. I read an article of that. So I think the issue is that for a lot of people, it's part of socializing. It's part of enjoying the meal. And that makes their digestive approach better. But a lot of people drink too much as well. And especially as people get older, alcohol has heightened effects on the body. It can affect some people. They're fooled because maybe they fall asleep easier, but it actually disrupts what we call our sleep architecture. So I'd be really cautious, and I wouldn't tell people to rush out and change their regimen, on the basis of that. So let's see. What about someone who doesn't like puzzles? There's got to be something someone likes, and you have to take time to find it out. And sometimes just talking to them, what do you like? What do you like to do? There's always something you can find. A lot of people don't like puzzles. They don't like the computer. But there's so many things out there that they can do. Nature is wonderful. Exercise. You can go on YouTube and find, history shows and whatnot that people like. So you just got to work at it and find out what they like and what they'll enjoy doing. There's no magic to something. And if you're forcing someone to do it, that's probably going to backfire. Someone asked about frontal temporal dementia. It tends to affect people at younger ages. There's a behavioral variant, which can be very challenging, a language variant, which is very challenging. In cases like that, you have to be really aggressive about making sure the person has adequate supervision, speech therapy. But people, especially the behavioral variant, can get into trouble. They can act impulsively, inappropriately, and especially someone younger, I've seen people who, almost get arrested because they're doing unusual impulsive behaviors because their brain is malfunctioning, and not everyone knows or understands that. So you really have to get a really aggressive assessment and intervention to protect the person from really doing dangerous things. Someone said the term dementia means without mind, or it's crazy. Why do they use that term? Oh, so yeah, the term comes from Latin. It means without dementia, without a mind. It has connotations of people being crazy or insane. And so I think it's still used because most people just know the term, and when I even give talks, it's a mouthful to always say neurocognitive disorder, neurocognitive disorder, neurocognitive disorder. So sometimes I still use the term, but trying to get people to shift and use the newer term.
Dr. Agronin, you have
Yeah.
been very generous in answering so many of our questions today, but we do need to wrap up.
I know it's getting late.
You have addressed most of them, and I thank you very much for that, and also for this extremely important and supportive webinar. We certainly appreciate all your time today and how much we've learned for our own ability to prevent neurocognitive decline, both before and after a diagnosis. Thank you also to everyone who attended today and for all of your very thoughtful questions for this Care Connection. I will be sending out a wrap-up email with any available information, and I will send you all a link to the recording when I have it. That will not be for at least a week or so. Before we end, I want to encourage you to sign up for our next Care Connection webinar next month, Thursday, August 10th, 1 p.m. Eastern Time. And Dr. Agronin mentioned how important exercise is. The topic of this conversation is exercise in senior centers reduces cognitive impairment. Our speaker will be Dr. Kieran Reed, a PhD and MPH, and he's the director of the Laboratory of Exercise Physiology and Physical Performance at Brigham and Women's Hospital and Harvard Medical School. So please join us Thursday, August 10th at 1 p.m. Eastern Time, and please take care, everyone, until then. Dr. Agronin, thank you again for today.
Sure. Absolutely. If you want online, I can answer some of these questions as well, the ones we didn't get to talk about as well, if it's up for a few more minutes.
Sure. You go right ahead.
Okay. Thank you, everyone, and I wish everyone the best.
And I'll stay with you if you want to address a couple of these questions before we sign off, if that's what you'd like to do.
Yeah. If you answered a question like after 2 o'clock, I'll go through these very quickly in case anyone wants to stay on for that, if you want me to.
Sure, go ahead, because I won't end the webinar.
Okay. Someone asked about small vessel ischemic disease. If you have that with Alzheimer's, does it progress more quickly? Not necessarily. A lot of small vessel ischemic disease is what a lot of MRIs read out as. It's another word probably for atherosclerotic disease, which is common in many older brains. So it doesn't necessarily predict a faster change at all. Especially, it's so common to see that in 80 and 90-year-old brains. I'm more worried about if there's small strokes. That's more of a concern. A lot of people asked about donepezil and about lecanemab. So let me mention about those. There are 4 FDA-approved cognitive enhancing medications. What that means is that 3 of them are from one class, so we pick one of them. The other is a different class of medications. We often combine it in later stages. They can modestly improve symptoms. They don't really slow down the course of it. And they're indicated for Alzheimer's disease, but they may have benefit in other forms of neurocognitive disease as well. So in one category, you have donepezil, rivastigmine, which also comes in a skin patch, and galantamine. They all work equally as well. And everyone should have, with Alzheimer's disease and probably other forms of neurocognitive disease, should have a trial on one of these. And, maybe modest benefit. And you can see that across the course of it. Memantine is a different mechanism of action. At some point, we like to add that on. And that can sometimes, the two together, people tend to do the best, but it's very modest and sometimes it's hard to notice. And they do have potential side effects, but those should be a mainstay of treatment. They're the only FDA-approved medications for Alzheimer's disease. We've been studying for many years, and we did this at our site, immunotherapy, which basically is what are called monoclonal antibodies. They're proteins that you infuse in someone on a regular basis. They stick to the toxic amyloid protein in the brain, and your brain immune system can clear it out quite successfully. And across those studies, what we see that it tends to slow the course of it. People don't get better or do better, but it appears to slow down the course of it when studying in people with early stage Alzheimer's. So this new one, lecanemab, just got FDA approval. There's another one called aducanumab, approved a couple of years ago. That's a monthly infusion. Lecanemab is every 2 weeks. It's not as simple as just going in and taking a pill. Number one is you have to qualify for it, which means you need proof of amyloid in your brain, either from a PET scan, a special type of PET scan, or a spinal tap. If you have that, you have to have early stage. So once you progressed a little bit, there's no evidence that's going to make a difference. And you have to medically be able to have this every 2 weeks. And there's different details of that. So without getting into details, someone with potential early stage Alzheimer's disease, that should be part of the evaluation with a specialist, which is either a neurologist, a geriatric psychiatrist, or a memory disorder center, to determine if you may be eligible for those treatments. And a lot of the workup is either not covered by insurance or maybe at some point. So it can be expensive to do as well. Someone asked about using donepezil for frontotemporal dementia. We do, even though these are indicated for Alzheimer's, in practice, people will use them for other forms of dementia. And in that case, it's worth a try to see if they tolerate it, to see if it has any benefit. And let's see, someone said, loved one with amyloid mid-stage dementia, resistant to doing most things you're hearing about, especially exercise and social interaction. So that's hard. You have to really find out what do they like doing and try to present that. But also keep in mind that actually the most common associated symptom along with the cognitive symptoms is apathy. So people begin to lose their motivation to do anything. And so the reason why this person might not want to do anything is not because they're resistant or don't want to, but they have apathy. So their brain's ability to motivate themselves is just not there. And we try to treat apathy sometimes with stimulants or stimulating antidepressants, but I would definitely speak to whoever's treating them, the specialist, about apathy and whether if that's present, can it be addressed? Someone said, are you going to do another presentation of medication? Sure. And that's up to the Alzheimer's Foundation, but there's many, many other topics here that are worthy of discussion. So
we have that recorded. I'll come back to you, Dr. Agronin. Thank you again so much for today and for taking so much time to answer the questions as well. We will sign off. Thank you all for attending, and thank you again, Dr. Agronin.
Thank you so much. I appreciate it.